It's just a little bit of a different way of working to the mainstream, where you're just expected to turn up to an appointment, you'll be referred to an appointment and you just turn up yourself. Some of our appointments don't particularly like having other people coming with them as well. So yeah, when a nurse turns up with a patient, health professionals can often be quite different. Especially with GPs. So I have had experiences where mamas have tried to take their babies into a GP service because they're unwell, and the receptionists have said no until you pay your bill for the mother, until you pay your doctor's fee, we won't see your baby. So advocating was very strong. That was pretty. You'd have to go on there, guns ablaze at times.
Yeah, fair enough too.
So yeah,
Is that all you wanted to say about the kaupapa, or shall we talk a little bit about poroporoaki?
Probably whānau in the Meihana model can be a bit confusing because it's down twice. So the whānau on the Waka is kind of whoever. So whānau for Māori are whoever Māori claim they are. Whether that's a friend, whether it's blood relative or not, it doesn't really matter. It's whoever that person feels they need to support them in that space. Often it might be cousins as well, they'll come. And also there might be a few people turn up too. So you need to be able to make space for those people to come in. Whānau down on the currents, the Ngā Roma Moana, is more about where that person sits in their whānau. So what responsibilities they have. A lot of whānau nowadays, and it's worldwide too, might be looking after younger siblings or grandparents that might be looking after their grandchildren while parents are working. And so therefore they can't come to appointments. New Zealand used to have a 3-shot chance and then you're out. So you get 3 chances of an appointment, irrespective of time. The hospital didn't really care what you were doing. They just expected that you would turn up, whether that's an 8 o'clock appointment in the morning and you've got 5 children you need to get to school, that they didn't care. So you'd be given 3 chances and then you're out. You go to the bottom of the list, or you'd have to go back to your GP and get re-referred in. So nowadays they're being a lot better, and they're trying to work around asking why people can't come to the appointments, or asking some of the Māori services to help with transport for people who can't make it in. So that's getting a bit better.
Yeah, at last.
When it comes to whānau as well, with Māori especially, there's often one person who will be the spokesperson for the patient. So in my whānau, even though I'm the nurse, when it came to health, my sister, who was a police officer, is our spokesperson. So whenever I would tell my parents to do something for their health, they wouldn't listen to me, but then I'd tell my sister to tell them, and then they'd go, oh, she told me to do this. Why didn't you tell me to do that? So, yeah, it's just your position in that whānau. My position was I'm the baby, so I don't get listened to, even though I'm the nurse.
It's usually the opposite, isn't it?
Yeah.
Where you take on everybody's ill health.
Yeah.
From the moment you step into nursing as a student nurse.
Yeah, no, not necessarily in the Māori whānau. And so that also happened for me in the hospital situation with my father when he was unwell and I was speaking for him. The doctor pretty much shut me down and told me that he didn't want to hear from me. He wanted to talk to my father.
Wow.
So it still happens quite a lot. My father had to say no. He speaks for me. But you know, there's some just little differences in cultures that can rub the wrong way sometimes. Yeah, but it's really good to have that knowledge as well. Yeah.
So to finalise the meeting with a Māori patient and whānau, poroporoaki is very important, isn't it? That you don't just say, well, goodbye. Can you explain that a little bit?
Yeah, so this often links into health literacy, which is one of my least favourite words. As health professionals, we will often blame our clients that they have poor health literacy. But actually, as practitioners, as health practitioners, we need to be telling our patients, we need to be giving good advice. So we need to be giving the education that they can understand. So poroporoaki kind of fits into this, where you need to make sure there's kind of 3 steps to it. So making sure that you've understood everything that the patients wanted, that they've understood everything that you've wanted to tell them, and then giving them the next steps. So what's going to happen next? When am I next going to see you? Is there going to be an appointment that you need to go to? What do you do if you feel unwell? If there's no new appointments, then who do you go to? So that's like increasing your health literacy as well. So it's really important. It's also so probably whakawhanaungatanga is the most important, and then poroporoaki is the second most important when it comes to the hui process. The Meihana model just gives you all of that information that you need to understand. So it tells you where that person is in their life. It kind of gives a broader sense of a holistic assessment model if used well. And it also can help with like engagement. So finding out what works, what the patient actually wants, what works for them, what their priorities are, and then educating and advocating as well.
Yeah, so really important in our work towards improving Māori health outcomes. So we're very grateful for the creation of the Meihana model and people like Mel who've put the model into action, working with Māori patients and whānau. Just so that you know, the Meihana model can be used by any health professional, but it is for Māori only, for Māori patients and whānau only. So the authors of the Meihana model, Pitama et al., have stipulated that. So it's a very attractive model. I'd love to use it everywhere, but it's been designed specifically for Māori and Māori world, Te Ao Māori. Was there any final comments that you would like to make, Mel? She could probably talk for hours, and she's wonderful to listen to, isn't she?
I think often what's a lot of nurses may struggle with who haven't worked in the community is to get that engagement, and especially with Māori, you're often having to get people to prioritise their health. Often it's not their main priority at that time. There's often other social determinants of health that are impacting on whānau and have that priority first. So a lot of my work was trying to help support people in those areas. And so it crossed over into a lot of the social work kind of issues. So some of the things that I have done, I did have a client who had cats. So she had 3 children, and she had a cat that also had a lot of children. And she was forever trying to find homes for these kittens, which stressed her quite a lot. So she knew that she needed to get her cats neutered, but she couldn't afford it. She had tried to go through lots of different options to get the cats spayed for free. And so I was able to get the Cats Protection League to actually spay the cats for free, which they have their own tikanga. They're pretty militant. They're very much, if you can't afford a cat, then you shouldn't have a cat. But actually, I had to argue with that point to say that, but they loved their cats. Like their cats were just the same as their family members. They were one of their family members. They did everything they possibly could. They had dogs as well. they paid, a lot of their money went towards the animals, feeding the animals. So the parents would often go without. And so once the Cat Protection League heard about that, they were like, okay, that sounds okay, we'll do this for free. So, you know, it's kind of that advocating, pushing a little bit past what other people will do as well. And, you know, with that, like the patient felt that I understood them. I prioritised her cats who she felt were like her family members. And then after that, like she was quite happy to follow other advice that I would give about health and well-being for her children as well. So, you know, it's sometimes that buy-in is really important. So, yeah. What else have I done? Oh, probably my one of the Māori values that I really love, and I use it even here, especially here, is tuakana tēnā. So that's tuakana is like older sister, tēnā is younger sister. So it's a Māori value where even though tuakana is often older and more experienced, the tēnā, the younger sister, still has her own experiences and her own knowledge, and so it's a reciprocal sharing of knowledge. So even though I sat in that space as a nurse that was there to help offer support and advice and education for child health, I could always learn from my patients too. So, you know, an example of that sharing of knowledge around services that were good choices for Māori to go to, that Māori had really good experiences with, was one. Learning so much knowledge, but also kind of the tuakana is the role model. So one of my favourite stories to tell was always a mama who had been in jail and she had 3 children. And I came to visit her and I just asked her, if you could live your life over again, what would you want to be? And she really wanted to be a lawyer because she'd had such a bad time with the justice system that she wanted to help represent other wahine Māori as well. And so I gave her advice around what she could do, support systems that she could get, scholarships that were out there and available, women's workshops to help build confidence. When I came back to see her, which was about 6 months later, she'd enrolled in the university and she was in her first year. And so it was really good. And then I could continue that through with giving advice around like studying advice, making sure that she was supported by people who are on the same track as her, and all that kind of extra stuff as well, extra advice that could just support her on her journey. So that was really rewarding.
Yeah, wonderful.
It's not just health that nurses can affect. Yeah.
Well, thank you, Mel. I feel really inspired by your kōrero, and thank you so much for sharing some of your experiences and thoughts and about the Meihana model as well.
Kia ora.